Okay, so here are the Lana family, and this is about our experience with transplant. We were transplanted in Cincinnati. Pre-transplant, the top picture there is Eli in September, just as he's starting kindergarten, and the bottom picture is April, what is that, 5 or 6 months later, the day we get admitted. So this all happened very fast for us. He got sick at the end of January, beginning of February of 2011. They gave us a diagnosis March 11th, and then we had transplant April 22nd. So we really just kind of got thrown into things, despite the fact that he had many, many, many physical signs and symptoms. He got missed. The first thing I needed to do, I'm a school teacher, so I try to stay organized. I got a binder, and it was really cute, a very cute, nice binder, but I had a section for insurance and for blood work and shopping lists and things to delegate and anything. I just wanted it all in one spot and something portable. So I just recommend getting yourself highly organized. The other thing that was difficult for me was accepting help. I'm kind of an independent kind of person, but we were kind of losing our minds, and there were a lot of people, and I think you would find this too in your community and in your family and among your friends. People are aching to help you, and you can do them a favor by accepting that help and making them feel better by letting them help you. Our community and our family did a tremendous fundraiser for us because we were going from Rochester, New York to Cincinnati, which is 550 miles. And we had to do this fast, and we had to leave 2 teenagers behind and 5 animals and a house that needed a lot of renovation so we could bring them home to a healthy place. So they put together a fundraiser for us and raised about $24,000. So that sent us on our way. But that wasn't even the end of it. His school sold bracelets and T-shirts, and there was a church. It wasn't even our church, but a church adopted us and paid our mortgage for us. So it's very hard to go public with this kind of thing, but if you just trust that your community will take care of you, they really want to. There are a lot of good people out there who want to help you. So yeah, when you're going through this, you're feeling completely out of control, and you're at the mercy of these doctors, and they're using these words that you have no idea what they mean, and you're just grasping for something. So my thing was, what can I control? And that was my attitude and my energy toward the whole thing. I felt personally responsible for every cell in his body. So I didn't want to introduce anything, whether it was a negative attitude or a toxin or anything to stress him. So I really worked hard on, kind of exploring my spiritual side and getting very meditative and trying to keep a positive energy. We prayed a lot, we meditated a lot, we did a lot of visualizing. We really relied on that for blood work and scary things, and even just sitting there. I remember getting the news the day that we were going to start searching for a donor. And the oncologist started talking, and she was talking really fast, and I put my hand up and I said, just give me a minute. And I stopped and I took 3 deep breaths, and I really did feel my heart just kind of sink back down to where I could listen, because that was the thing. There was all this information, and if your mind is going 1,000,000 miles an hour, you can't take anything in, you can't remember anything. So that was important for me. And then the other thing, a lot of you know this already, but I really went after Eli's nutrition. And I consulted with a very dear friend of mine. Her name is Christine Dionese, and she's actually spoken at the adult meeting, and she's actually published in the FARF newsletter. But she's a genius with nutrition, and she's got a lot of experience with cancer and oncology and hematology. So she really helped us out coming up with things that would support him and keep him as healthy as we possibly could going into transplant. So the inpatient experience, the top picture there is the day he got his transplant. Then we've got, going around kind of clockwise, we've got several of the medications. There he is with his NJ tube before he lost his hair. And then down at the bottom, you can see his whole IV pool that we named Spike. That was Spike. But that was all of his medications and everything. The pain management, again, we used a lot of mind visualization and humor and things like that, but we also used a lot of morphine. And the morphine was great. He had we called it the Jeopardy button. We watched Jeopardy, and when it was time to hit the pain pump, he would say, "What is morphine?" And he would hit it. And if it beeped and he got the dose, he would say, "Yes!" So that was great. Lots of humor. We tried to use lots of humor. We were really big on routines and comfort items and just keeping the relaxation. We relied a lot on the child life specialists. We learned about steroid meltdowns. We hadn't had a lot of experience with steroid use. And the way we dealt with that is just by explaining to him that this is the medication, it's not you, because he doesn't have that kind of personality. So he was just as confused by these rages as we were. So we really helped to just talk him down and really listen to him and help him explain. And he was 6. So you have to do it in those terms. But he got it, and he wouldn't like it, but he would say, "I hate this medicine." But he was able to control it a little bit despite how he was feeling, so that was a great success. The mucositis that they warned us about, I think of mucus as, runny nose, and it was pretty horrendous, and it started with gut pain. It started with belly pain, so I wasn't expecting there to be so much pain involved, and there was. So there were a lot of things like we used hot socks, which are basically socks filled with rice, and we would heat them in the microwave, and they were just comfy on his belly. So that and the morphine. As far as complications, other than the mucositis, which is a typical complication, we had his B cells were cropping back up, and I think it was after he got initially discharged that his counts started dwindling, and of course you're worried about losing the graft, and they treated it with something called rituximab, and it did end up keeping us in Cincinnati for about another 4 weeks, but it worked. He did have a reaction to platelets. And that was actually during the mucositis flare-up, so that was pretty scary. He had kind of an anaphylactic reaction to platelets, and it was because the pain management team was there checking him that they even caught it as early as they did, because they heard the wheezing. And he says, has he ever had a reaction to platelets before? And I said, well, yeah, but he usually gets hives. And then I looked, and he had hives forming over here. So he started, his airway started closing, and then he's coughing, and he's got the mucus, and it was very dramatic and sudden, and that was scary. That was our scariest day. But they all came in, and they took care of him quickly. And then, of course, the BK virus, which I don't know if you've already gone through transplant, show of hands, who's had the BK virus with their kids. It's very common. And it's just a kidney bladder infection. Not comfy, not fun. But then my 2 tips at the bottom for the Actigol and the egg crates. Actigol is one of the medications up there, and if it gets into the tube, it can clog it. It's like concrete. And we learned that if you squirt some Coca-Cola, it has to be Coke, it can't be Sprite, it acts like Drano. And it may take 5 or 10 minutes, but it's better than having them take the tube out and replace it. So you might as well just wait a few minutes and give the Coca-Cola some time, because I guarantee if you've got a feeding tube and if you're using Actigol, it's going to clog it. So just remember the Coca-Cola, because they don't all know about it. And then the egg crates, you need egg crates for the pull-out sofa thing in the room. I actually just talked to a mom yesterday, and she was saying, this bed is terrible. I said, I forgot to tell you about the egg crates. So bring the egg crates with you. After discharge, we got sent to the Ronald McDonald House on day 32. And again, here's, Eli. This was his trademark. He was a big John Wayne fan at this time, so everywhere we went, he dressed like that. And then in Cincinnati, we have the Dragonfly Foundation, and they actually got us this luxury suite. Tim had actually gone home to work on the house, and he missed our luxury suite experience. But we had food for 12, Eli and I did. And he wasn't eating yet. He had food aversion. He wasn't eating yet, so that was great. But you can see the mask and the wipes on the side, but that was nice. It's a nice perk of being in Cincinnati that they have Dragonfly there. If you're not a nurse already, you will become a nurse after you're discharged, and it was scary at first, but then I would prefer to just have us doing it rather than having to, wait for the nurse to show up and have to clean up and act like a normal family while she was there. So it was just easier to do it all myself. But what I did was got just a big dry erase marker board and just wrote my schedule up there. So when we were hooking up pumps and giving oral meds and everything else, dressing changes, everything was on this board. So it was, like a nurse's station, but it was in our room. And I also went to just Target, and I got a bin full of the plastic drawers to keep all of our stuff organized. When he was learning to eat food again, the speech therapist was a great help. There were all kinds of games and things that we would play. He started getting his tastes back he wanted bacon and salsa, so he ate that for a long time. And they did warn us about the dreaded black tongue, and I will say that Eli did get the dreaded black tongue, and it's a fungus, and they tell you if you don't do your mouth care, you're going to get the black tongue, and he did. But if you can keep up with your mouth care, it's just one less thing that you have to deal with. It's not a serious complication, it's just really gross. And then the real fear sets in when they tell you can go back home and you're not going to be across the street from the hospital anymore. And for us, that was day 132. And day 100 is a myth. It's not true. 70 days. That's incredible. So yeah, we had our heart set on day 100, and unfortunately it didn't happen. And that was when I was saying with the B cells, and we had to wait for the rituximab to work. So that's what kept us there. He never did get readmitted. He didn't have any other infections or anything like that. Anything that he needed care for was just treated at day hospital. So that was great. Once you get home, the tough part is keeping people away because, they think home is visits and playtime and play dates, and it's not. And it's very isolating because you're so excited to be there and then you can't share it with anybody. So that was very hard. It was very gradual. And yeah, you're germophobic. I had a half a gallon of hand sanitizer at my door, and I still do. It's still there. So the other thing that helped Eli with the after discharge was that for his school he had an inquiry project, which by the way he missed half a year of kindergarten. The following year was first grade. He went in May, so we went all the year until May, and then he went a couple half days here and there. So he really didn't start back to school full time again until second grade. So he was out about 18 months. But during that time, his school has kids do these inquiry projects. So he wrote a book called Going to the Hospital. And I just sent it to his nurse care manager thinking, oh, she's going to think this is cute. And then they ended up loving it and they published it. And actually Cincinnati hands it out to kids now. So if you're going to Cincinnati, you'll get Eli's book. But it was just a nice way for him to kind of relive things and work through things and put his own words to it. And the hardest part, I think, of the whole process is treating him like a normal kid again. That was terrifying.